Swain Event and SwainEvent.com, fueled by Dead End Barbecue, top 100 barbecue restaurant in America. And joining us via the B-Dry Waterproofing Hotline, General Surgeon Dr. Jessica Vinsant, who is based at the Premier Surgical Office at Tanola North, Knoxville. This week is this month is Breast Cancer Awareness Month, and there's no one else better to bring on to talk about that than Dr. Jessica Vinsant. Doctor, good morning.
Good morning.
How are you doing?
Good. How are you?
I'm fantastic. It is Friday, so first, the day before the game. Tennessee, South Carolina. Tennessee's going on the road tomorrow with a great chance to win. I am wonderful. I'm wonderful. It's so good to have you on this morning.
Thank you for having me.
And first, let me just ask you about the breast cancer treatment and what are some newer techniques that people need to know about when it comes to breast cancer treatment that you guys are executing?
Well, a lot of patients are surprised by the number of options that we have available now. We have the ability to do hidden scar techniques where after it's healed, you can hardly tell that there's even been a surgery. We employ oncoplastic techniques, meaning both taking care of the cancer and reconstructing the breast. So again, less deformity than we've ever had before. In terms of medications, now we can do genomic testing on your specific cancer and determine which patients will benefit from chemotherapy and which ones can skip the chemotherapy. Whereas in the past, almost all patients with breast cancer would end up with chemotherapy. We have some medications that target specific parts of your cancer, and so we know whether or not the medications are going to be beneficial before we put you at risk for taking them. And then a lot of women and the occasional man that we have that comes in with breast cancer are surprised to know that there's equal overall outcomes for whether or not you have a lumpectomy or if you have a total mastectomy. So fewer and fewer patients are requiring total mastectomies than ever before.
Doctor, how has increased awareness and early detection helped change the game, so to speak, for breast cancer patients?
I think there's less stigma around having breast cancer, and there's more open communication about what breast cancer means for the patients that are affected. Also, we're able to cure more patients than we've ever been able to cure before, and frequently without the level of potentially deforming surgeries that were once employed. We also have more options from both surgical and non-surgical standpoints for the unfortunate situation where somebody presents with advanced cancer already.
As a physician, what do you want East Tennessee women and men faced with breast cancer diagnosis to know?
Although being diagnosed with breast cancer is a life-changing and a very challenging time, you will not be fighting alone. There are so many resources available to support you and your family during this journey. You'll be treated by a multidisciplinary team, and there are also lots of groups that can help financially if that is one of the barriers to you seeking treatment. And then especially with men, if you feel a lump in your breast, go get it checked, because frequently men don't consider themselves as potential patients with breast cancer. And about 1% of breast cancer occurs in men. And so since men don't typically check their breasts, it tends to be a little bit more advanced when it is found. So if you feel something, go to your doctor, go get checked out, because the earlier we find it, then the higher the chance that you're cured.
Well, Doctor, it's the day before South Carolina game for Tennessee, so we have to ask, what is your opinion on the game tomorrow? Who's going to come out on top?
Of course, Tennessee.
That is the correct answer.
You win a brand new car, Doctor. You win it. You're the winner today. I have a friend of mine who is who was diagnosed with breast cancer, and you talk about that 1%, and he was one of those he's one of that 1%, because you never really think about it if you're a man. And then I also have someone close to our family, um, that's a female who has been diagnosed with breast cancer, and it's not been a pretty sign at all. She's in some pretty bad shape. So this is serious. This is
Yeah,
serious business here.
it is.
And we just thank you so much for joining us this morning. And great prediction, Tennessee beating South Carolina. We hope it
Yes.
comes true.
Me too.
Yeah.
And thank you for having me.
Thank you so much. Dr. Jessica Vinsant here on the show, surgeon with Premier Surgical.